Good morning, everybody. I hope somebody can hear me.
Yes, we can. Good morning.
Good morning, sir. Thanks so much. Thanks for your time. I don't know, Dr. Bayo, if you can hear you now, maybe you should just run through the introductory before I start. My colleague Adebayo is having some technical issue. He can hear us, but we can't hear him. So I don't know. Adebayo, can you say something? Let's see if we can hear you. Or can you type? We can't hear you. Okay, let me help him out. I think the issue still persists. But what I want to say is that he is supposed to take the introductory part while I do the training, and then we go on to the questions and answers. But be that as it may, I will help him out. We partner together to have this training. If you look at the leaflet, or let me say the E logo, for the training, that's the partnership between E's organization and Zoetis-ALPHA Initiative to bring this training to you. And then we are going forward after this meeting to actually take the feedback from people, from stakeholders, so that we could plan future training. So we are not going to be determining the topic now. Going forward, we'd like to hear from you to determine what topic we are going to be treating. But for today, kindly bear with us. We've already chosen the topic. We'll be talking about a journey towards antibiotic-free production in poultry. And the focus will be on gut health and proper vaccination. So once again, my name is Bankole Niyi, and I'm glad to have you here, and really appreciate your time. And I want to also tell you that we also have colleagues from Ivory Coast and from East Africa. And it's nice to have you here, Wakibia, and then my namesake Bankole from Benin Republic is also here online with us too. So let's dive into the real topic for today. So please, as we are going on with this training, you can drop your phone number in the chat. We are going to create a forum after this meeting that will use to have a community of our trainees, so that in the future we can actually hear from you. What are your concerns? What you want us to train upon? I think it's better if it's coming from you, not from us any longer. So we'll be looking at how feasible is antibiotic at the gut and its functions, the importance of the gut, gut performance versus immunity, and the negative drivers, the vicious cycles of enteritis, proper vaccination, and how to manage the gut health properly. So, how feasible is antibiotic-free production in poultry? We all know that in poultry there are three basic things, or let me say inputs, that are very essential in our production. We have the feed and the raw materials for feeding. We have the day-old chicks, and then we have the management. It's an input, which is the knowledge base of the farmers, and all these comes together are the inputs that we use in poultry production. So they are very important, and we need to ensure their quality before we can say we want to start the journey into antibiotics-free production. So I will look at each and every one of these inputs. The feed and raw material in most cases can come with anti-nutritional factors like toxins. The cheese can come with problem from the artery, be it infection, and so management could be very, very lacking, which is one of the biggest problems that we have here in Nigeria. I might not be able to speak for other countries, but these factors, all of them have a lot of things under them. You don't know what the chicks are bringing, the maternal antibody level, the infection they are bringing, your raw materials. You cannot even say the number of mycotoxins and some other preservatives or chemicals that you are carrying. And then the management, which is very, very dynamic. It's changing every day. And then it calls for farmers to be on their toes, to be able to keep track of their management and ensure that they are doing everything properly. I'm sorry, I'm the one playing the role of the admin together with the training. So we need to ensure the quality of all these inputs and also to update the knowledge of stakeholders in this industry about the best management practices, which include vaccination. It is after then that we can say that the journey into antibiotics-free production starts. So by the time you are able to ensure good quality out of all this, then you can say yes, you can go into a free antibiotics production. But in the absence of the perfect raw material chicks and even the management, how do you start the journey in a stepwise manner? That's exactly what we'll be looking at today. So also, I would like to call our attention to the fact that every step we take towards this production is a step in combating antimicrobial resistance. It's a step in ensuring food safety. Food safety in the sense that AMR is also becoming issue in a human being because of the residue that we are all eating from egg and meat, and also because we are constantly dosing ourselves with some low-level antibiotics, which is not good for our system. And then by the time we are able to take care of this first two, we are able to sustain our production. What do I mean by sustainability? When you are able to run your production without antibiotics effectively, and then they are not when you are abusing them. And then finally, a drop in the cost of production. So we go to exactly what the gut looks like in chicken, starting from the mouth to the crop, to the proventriculus, to the gizzard, to the duodenum that houses the pancreas, the spleen, the liver, the gallbladder, the small intestine, and then the largest intestine, down to the cracker. That's exactly what the chicken intestine looks like. I'm sure a lot of us are aware of this. So now, let's go down to the cellular level. Within the intestine, the most important structure are the villi, or the villus, as a single one, and it's what I have here in this picture. So most, if not all, the entire internal wall of the intestine is covered by these finger-like structures. And then on them, you can see some other browny, or let me say pinkish, don't mind my color description. You can see a lot of other projections that are called enterocytes. These are the units, the simplest unit of the intestinal cells. And they are the ones that are involved from the intestine, and they are very, very crucial in our production. Apart from the digestion and the absorption nature of our function of the intestine, in chicken, it also houses over 50% of avian immune system in form of the gut-associated lymphoid cells, or the mucosa-associated lymphoid cells, like the Peyer's patches, the Zika tonsils, the Merkel diverticulum, and the esophageal and pyloric tonsils. And I'm sure somebody will be asking, why are these immune cells focused on the intestine? And I want to tell you that the number one answer to this question is the fact that a lot of the vaccinations that we give, either by drinking water or spray, we end up in the gut. And then you need an immune response to them, which means the immune response, the local immune response in the intestine is very, very important. And that is why the nature has deemed it fit to keep a lot of these immune cells along the GIT of a chicken. So I have an electron micrograph of what a villus or the villi should look like. And these are at various portions of the intestine. But they are more concentrated around the duodenum because that is where you have the majority of the absorption going on. So going to the functions of the intestine, we have the digestion and the absorption function for the nutrient, the immune function, T cells, B cells function. Now, I would like to mention one other thing. For some of us that uses laboratories, you cannot measure the immune response in the intestine. So if you have a local response in the intestine in form of the cells or the secretory immunoglobulin A, which I wrote as SIGA here, you cannot measure them. So it's a kind of immune response that for now, it only takes some serious research to measure, but they are protecting our bed. And lastly, the waste disposal. So after you've had a lot of ingestion, they all still go out via the gut. So now, one of the biggest functions of this villus is to increase the surface area. So you can imagine if the intestine is just a blank pipe that runs from the mouth to the cloaca, that means food will just go in and then go out very fast. So the presence of this villi or the villus have increased the surface area. So you can imagine that the nutrient and feed materials will have to pass through all these surfaces gradually. Secondly, they have secretory functions. That means they secrete a lot of things that aids in the digestion. For some of us who are doctors and remember our anatomy back in school, we know this is the crypt of Libacum, where a lot of secretions are going on. And then the length of the intestine allows the food to pass through in a very slow manner, gradually, in such that it takes time to pass through, and then it allows for maximum absorption from the intestine. So now let's go into the real topic of today properly. Sorry, I have to keep somebody on mute. Please go on mute if you are not speaking because of background noise. Please, thank you. So what is gut health? The answer to this question is that gut health is whatever you have achieved based on what you have done on your farm. So it's the resultant effects of a delicate balance between microbiome, the anatomical integrity of the gut, the nutrition, and then the immune response. So it's very delicate. Now, if you look at the intestine, first and foremost, talking about the microbiome, we have a population of microbial, or let me say, organisms within the intestine, which is a balanced population. So if you're able to keep this population balanced, then you have maintained the gut health and you will be benefit. The anatomical integrity, I showed us the villi the other time, and on top of the villi, there are a lot of enterocytes. These enterocytes are joined together by what we call junctions or junctional gaps. These enterocytes, they are joined together by junctional gaps. And then if you're able to maintain your flock in good health, you also have the benefit. And again, the nutrition, what do you feed to bed? There are some things that does not digest very fast. And then at the end of the day, what do you have? They tilt the microbiome balance in such a way that a lot of unhealthy microorganisms begin to grow in the intestine, and then problem sets in. And then lastly, you want to keep the gut in a silent state of immunity. What do I mean by silent state of immunity? You don't want to keep agitating the immune system, because the more you agitate the immune system, the worse it's going to be for the production. You want to limit their agitation to the vaccination that you have given to them, not to having infection, agitating them all the time. So the effect anybody is going to get is a balance between. This is very, very delicate. So how important is the gut? Most importantly is the port of entry into the body. Everything you are going to give, vaccines, drugs, the feed, everything comes through the mouth. Or let me say most through the mouth, except for some vaccination that have been injected. Again, the gut in chicken is proximal to a lot of systems. In chicken, we don't have diaphragm, so the gut is in contact with the air sacs. It's in contact with, I want to say maybe the lung, but with the air sacs, is in contact with the reproductive tracts for layers. And so whatever happens to the gut can easily move across the border into other systems. And then, like I have mentioned, it houses the microbiota, or it's an environment where the microbiota interact in a balance. So the gut houses this bacterial population in a balanced proportion, and they are referred to as the normal flora. So whatever happens to these populations sometimes is what leads to dysbacteriosis. I'm sure most people that are non-vets might not understand what dysbacteriosis means, but a simple misuse of antibiotics can lead to dysbacteriosis, and this is not very good for production. So we have the immune function. It protects from infection, and then local responses to vaccination. So like I mentioned the other time, you want to limit the agitation of the immune system mostly to the local response to vaccination, and then you want to reduce the impact of pathogens on the immune system. So with all this importance, I want to ask us some rhetorical questions, which we are supposed to answer inside of us. How much of attention are we paying to the gut? So that takes us to performance versus immunity. There are two main negative factors that affect poultry production via the gut. And then I put broiler in brackets here because it's most obvious in broiler because of their short life cycle. The number one is maintenance, and the other one is immune system. Maintenance in the sense that as the animal is growing, the gut is supposed to be maintained. The anatomy is supposed to change with age, and supposed to meet up with the current challenges. But this is not usually the issue for so many reasons. Again, the immune system. In some cases, the same reason why the animal is not matching up with the age and requirements. So also, in some cases, the immune organs are now also well developed, and this leads to a lot of tolerance issue. The immune system being challenged unnecessarily. And then why do we have these two negative factors? Is because the current breeding program from a lot of the big companies, be it the broiler breeder company in Europe, America, or the layer breeders, they are all the junctional gaps among the enterocytes sometimes is not even well developed because the birds are growing at a very fast rate than usual. So what do you have when you have all this kind of situation is that the immune system within the GIT will be frequently stimulated, or let me say overstimulated. And then the implication of this is that the ADG, which is the average daily growth, will stagnate. So what is happening is that the gut is not well developed, the immune systems are not well developed, and then they are being currently challenged. So the bird, the challenge will become so much that the bird will focus on immunity and then growth will stagnate. So average daily growth will stagnate, which means FCR will shoot up. That means you feed more for the birds to gain weight. And essentially what is happening here is that nature is kicking back. Like I said, I used the language that time, permit me for the lack of a better word, that our greed have made us to breed fast-growing and highly productive animals. And then we have neglected their immunity. So nature will never be cheated. So what genetics has failed to do, nature is making up for in this bear. So the growth will stagnate, the FCR will shoot up. So that takes us to some negative drivers in gut health. These are one of the biggest causes of poor gut health. The first are the infectious agents like the bacteria. We have most important E. coli, Salmonellosis, Clostridium, and some others, a lot of others. But these three guys are one of the most important. Then we have the parasites like the EMMSAR, the coccidial organism of coccidiosis, and then we have the vira. And sometimes they work in conjunction. I will still get to this later, but let me mention now that when you have infection with coccidiosis and you have treated, even you have treated successfully, Clostridium can enter the wounds that has been created by the coccidiosis, and then it will lead to necrotic enteritis, which is very, very difficult to treat. The second one is or let me say the third one, the feed quality and management. A lot of anti-nutritional factors like the non-starch polysaccharide. So for those of us who are into feed milling, we really need to be very careful about this. What do we put in our feed when we are milling? It's not everything that you put. Whatever you know that the chicken cannot digest easily should not be in their food, because some of these materials will reduce the motility of the guts and the passage time of the feed, and then they will allow a lot of bad organisms to breed in the gut. I've mentioned toxins, and also we have a big problem in this part of the world where people preserve grains with chemicals, and they don't allow enough time for the effect of these chemicals to win before they sell. And then lastly, the physical texture or form of the feed. We are talking about the structure here. I'm sure we are all aware that crumbs and pellets are somehow better than mash for one reason or the other. For instance, crumbs are better because they have this rough feeling and the rough texture, and then they stimulate the gut of broilers if you give it to broiler chicks to eat more. And then another advantage is the fact that before you have crumbs or pellet formation, this feed has been pre-cooked. So, and we know pre-cooking has made the starch to be more digestible, one, and it has reduced bacterial load. So if you have crumb formation at 140 something degrees centigrade, we should be rest assured that the bacterial load in such a feed is highly reduced and the starch has been well cooked for the chicken to easily digest. So some of the diseases that are the major negative drivers, we have coccidiosis, which we all know, and then the dysbacteriosis. Dysbacteriosis is not very easily diagnosed, but if you get to a flock, what you notice is that you will see some brownish feces in the litter, and then if you look at this feces very well, you see undigested feeding material there, and sometimes they will be foamy. So if you have this, you know that you are having some cases with dysbacteriosis. And like I mentioned, a lot of things can cause dysbacteriosis. If you feed some materials like the non-starch polysaccharide, if you abuse antibiotics, it will lead to dysbacteriosis. But we all know that coccidiosis is an infection from the environment, which we can prevent. So these are some of my experience with coccidiosis and necrotic enteritis. We can see them in the pictures here. So looking at the conditions that are causing these negative drivers of the gut health in poultry, the coccidiosis, the viral and bacterial enteritis, dysbacteriosis, and finally necrotic enteritis, like I mentioned, they have a synergy. So anything that causes enteritis, if it's not well managed, will end up in necrotic enteritis. So whatever happens to the gut, if not well managed, in over 90% of the cases, we end up in necrotic enteritis. Be it bacterial enteritis, be it coccidiosis, be it dysbacteriosis. So and like I mentioned the other time, coccidiosis will go, you come, you will treat it, and then the wound created by this AMR organism or the coccidiosis will be infected by Clostridium perfringens, and then it will lead to necrotic enteritis. So necrotic enteritis is like the end stage. So like in human being, when we are talking about end stage of a cancer, necrotic enteritis is the end stage of any insult that happens to the gut, and it's very difficult to diagnose, also very difficult to treat. And again, it runs a subclinical course in some cases that you will not even be able to diagnose it with your eye. You might have to go do histopath, and it takes a lot of things from the farmer. It causes a lot of silent loss. You can imagine somebody who is having a broiler house of 5,000, and then necrotic enteritis is making you to lose 50 grams of live weight per bird. If you do the multiplication, you know that that's a lot of money that is being lost. So, and there's a vicious cycle. Like I've mentioned before, high feed intake, you give too much feed, or the one that contains the non-starch polysaccharide, or you have coccidiosis, toxin, viral infection, it can lead to increments in the number of the Clostridial organism in the gut. It can open up the wound for them to infect. Anything that alters the gut morphology will allow the Clostridial organism to enter. Poor feed digestion, or when you use bad things for milling, and absorption of the nutrient, we also make the gut to lose its function, and it will allow it to lead to necrotic enteritis. So it's like a vicious cycle. Whatever happens somewhere can lead to another thing that can lead to necrotic enteritis, or it can even lead to necrotic enteritis directly. So it's a vicious cycle, and that's one of the reasons why we need to take care of a lot of these factors: the nutrition, the immune system, the gut. You have to keep the gut in a silent state. You don't allow it to be too agitated. So with all these, you are able to help your birds to grow better and perform better. So I mentioned the fact that necrotic enteritis can run a subclinical case. So if you, as a vet, if you have done a PM or necropsy, and you are able to say, this is necrotic enteritis, you are able to see it, that means the problem has caused 100 times more damage than you can actually evaluate in terms of mortality, in terms of weight loss, in terms of how much the farmer has spent in treating what he's not even aware of. So the necrotic enteritis is like an iceberg that you only see the tip, whereas the bigger problem is below that you can't see. So what are the focus area in gut health? Number one is oral tolerance. Like I mentioned, you want to keep the gut in a silent state. You don't want to activate it unnecessarily, except for vaccination. So you want to keep the gut in a state of non-activation, which is ready to only attack pathogen. You don't want to keep challenging it unnecessarily, because the more you challenge it, the more the average daily growth will decrease, and then FCR will shoot up, because the bird will divert the energy, all the resources from growth to fighting these conditions. Number two is good nutrition. You want to avoid all forms of chemicals, toxins, and then non-starch polysaccharide. Then you want to control coccidiosis, not treating it, because the wound created by coccidiosis is a very good avenue for E. coli, for Salmonella, for Clostridium perfringens, the causative of necrotic enteritis. And then you want to maintain the gut population, the microbiota. You want to maintain them in their delicate balance. You don't want to cause a disruption. So as much as possible, you want to avoid the abuse of antibiotics. You want to use pre and probiotics. And then there are some key vaccines that you want to use. I will talk about that under the proper vaccination. and then the good vaccination protocol. I will still mention this again because a lot of us are using the old system of vaccination, the old booklet they give to us in the archive. But I want to tell us that vaccination has gone beyond this stereotype that we are all familiar with, because the diseases are changing in their dynamics. So also our own strategy is not supposed to be static. So vaccination has changed. If you need help, you can contact your veterinarian and some other people like myself to get help on the current trend in vaccination. So I mentioned the other time that necrotic enteritis can be very, very suffering. For some of us that are familiar with what histopath is, if you look at the picture on this picture on the right, you can see this is a villus that I showed to us the other time. And then if you see pathologists to interpret this to you, you will notice that this thing is swollen up already, which is one of the signs of enteritis. So there's an inflammation in that gut. So even if when you cannot pick it with your eyes, these are the rules of diagnosis for you to be able to determine that, oh, this is my practice. This is what I'm feeding. How effective are they in preventing necrotic enteritis? So apart from looking at your FCR and the performance of the bed, you want to see, is there any subclinical case? And then you can use this kind of test. And I can tell you for them to do a single of this test for you is around 1,000 plus naira. So it's very cheap. It's what you can do for 5 of it in a flock. And you get the interpretation and you know that, okay, am I supposed to adjust my management of the gut, or what I'm doing is actually fine for now? So talking about proper vaccination, we have an evolution of organisms which are resistant to antibiotics. And despite this fact, new generation of antibiotics are not readily available because it takes a long time for research to be able to make these discoveries. So the best chance we have is to modulate the microbiota in a way that it will be to our benefit. And apart from pre and probiotics, some live vaccines are very, very key, like E. coli vaccination and like salmonella vaccination. So talking about how to maintain the microbiota, these vaccines, if you introduce them early in life, they go into the gut and then they are able to establish themselves and compete with these pathogens that are there. So once they compete, they will reduce the population of the pathogen. So apart from stimulating local immunity, they work by what we call competitive exclusion to make sure that they are in the gut also. So if you have in the gut, you have 1 million E. coli organisms, 400,000 are the bad, 600,000 are the good ones. So your chickens stand a good chance of doing well because the good guys are more than the bad guys. So, but in a case whereby the bad guys are more than the good guys, then there will be a lot of problems. And in most cases, antibiotics might not be able to help out in that situation. So I have a study here, if I can share with more with people that are interested about the use of live E. coli vaccine in a flock, and then the response in protection to avian pathogenic E. coli. That's what they mean by APEC. And we see that pericarditis is actually lower in the vaccinated. Air circulitis is lower, and even mortality overall is lower. So it tells us that this vaccine, as much as they affect the gut, they also go into the respiratory tract and they give you the good responses. Then, like I also mentioned, E. coli is not supposed to be, coccidiosis is not supposed to be treated, but managed or controlled. And a lot of us have used a lot of things against cocci in the past, and we say these things are not working. It's not that these things are not working, but we have used them over and over again, and at a point, the organism on our floor within our local community has developed resistance to them. So for coccidiosis in Zoetis, one of our best solutions is the rotational system of control, which takes you through different classes of drugs, from the chemical to the lactulose to the different classes of the drugs, and even vaccine, so that you don't stay too long on one. And with this, you are able to effectively control and not treat coccidiosis. So I think that's all from my side. Thank you very much. Thanks for your time. Thanks for listening. Dr. Bayo, can we hear you now? Do you have your audio? Maybe you should stop the recording.
My name is Ruth Olofetaya from the UK.
Good morning, ma'am.
Yeah, hi. Thanks for this presentation, although I lost a big chunk of it, but I think I still gleaned a little bit from the latter part, which is very, very interesting, I think, and very, very, novel, I would say. My question basically is, how do you measure the efficacy of these new innovations with your farmers or the takers of what you are presenting here? How do you know? How do you measure the efficacy and that it's working basically? Yeah.
Okay. We draw the program for the farmers based on their operation. I mean, the rotation that somebody is using on his farm might not be the same that someone else will use on another farm. That is one. Two, once they start this program, we visit them, although it's a bit difficult for the kind of operation we run in Nigeria, because it's hard for you to tell a farmer that, sir, I'm coming to your farm and then I'm going to be picking 4 healthy broilers to sacrifice, but we still find a way to do it anyway. So we take samples from these animals that we sacrifice, we take the intestinal scraping, we take it to the lab to check for cocci. So for somebody who is using a particular drug, I have to clear this now. The drugs, apart from chemical drugs, some of these classes are referred to as chemicals within the antitoxic group. Every other drug, they give you what we call seepage, or let me say leakage, in the sense that you will still find some level of cocci that are not causing harm. So I know the level of the load I'm supposed to find in those beds based on the program, based on they are running, based on the current treatment that they are receiving in preventing cocci. So we look for the load, and if it's vaccination, you obviously see the load. For vaccine, what we do is histopart direct. You don't even try to look for the load in vaccine, because you obviously find a good cocci, which the microscopy cannot differentiate. So we do a monitoring to follow up, and also we monitor closely the FCR of the flock to see if things are going fine. So a combination of the load, the FCR, and sometimes histopart tells us how well the flock is faring.
Thank you. I think the latter part of your answer actually gave me what I wanted to know, that you want to make your outcomes tangible, not to yourselves alone, but also to the farmer, the producer, or whoever your clients that you are dealing with. And this has got to be evidence-based. And so FCR, are there other parameters apart from the FCR, which I think is very obvious? Are there other calculators that you use and for measuring your outcomes as well?
Well, on
FCR is good enough. But
yeah, it's good.
If you are not considering anything else, you might be in a better stead to explore other ways to
we encourage the attendant to take the daily weight, because these are farms that we don't go every day. So they are from the daily weight, we are able to monitor the average daily growth of the beds, and from the average daily growth, you can actually see what the FCR looks like on the weekly basis, because FCR on daily basis might not really give you some significant difference from day to day, but weekly it will give you something that you can work with. So
fantastic. I guess what I'm saying as well is, look at morbidity data, your mortality data, the quality of life of the chicken. There are, I know for us now in the UK, in Nigeria, it's a bit too much to be asking, but there are a lot of equipment that can measure how happy or the quality of life of the birds in the flock. Well, obviously that will apply to more commercial producers, I think, but that's where you are also wanting to target as much as possible. So I'm just stimulating your mind to look, outside of the box as well, and to see how you can expand all these measurements, because that way you can reach out to a lot more people and obviously might be more productive in your venture. Anyway, thank you. I don't need any more answers. I'm just a little bit of contribution. Well done.
Thank you very much. Thank
no
you.
worries.
Sir, Dr. Bayo also have a question. Dr. Adebayo, please ask your question.
Is he putting it on the chat or?
Yeah,
No,
good afternoon, everyone. Good afternoon, everyone.
Good afternoon, sir.
Yeah, I have two questions, and I want to start with the last person that raised an issue on how well we can do a live check or live follow-up of our broilers. What we do in our company is that we work with a lot of SHF farmers, and then we have a platform where we monitor. We can run like 100,000 broilers in a cycle. So, and we do a lot of online monitoring using our special database that we have created. But most importantly is that we are looking for a solution that what she just mentioned now, that can give us a live update, something that can measure the health of these beds almost real time online. That gives us an average idea of what is happening in these beds and on these farms. I don't know if you have any solution like that. That's the first thing. The second thing, just like what she said, our ability to be able to predict quickly, early, from the live bird, not even from probably necropsy or probably taking samples to the lab, something that is live, in situ. That's number one. Number two is, I have had cases from some of my farmers, some of the SHF that we work with, I mean smallholder farmers across Southwest and some other farmers in the North. They will tell you they see cocci even before day 4 or day 5, or quite very early in the life cycle of your broiler. And by training, we're told it's quite difficult for you to have cocci or EMMSAR species growing within that short period of time. And over the time, I've always doubted their position. But I just want to run this by you. Is it possible to have EMMSAR species, cocci, in broilers in the first few days, 2-3 days? And if you have seen such cases, how was it handled?
Let me start from the first question. I'm sure the current database that you use, some people are feeding information into it. Maybe the feed, the body weight. Am I right?
Exactly. What we have is that we have a data entry guy that works with all our farmers. So so we are trying to convert that collection directly into an app where it will be directly from the farms. But for now, we have a data entry staff who does that for us.
Okay. Now, for something that can actually do this directly without having to do all this data entry, like to monitor the quality of life of the chicken, from what she said, she's just opening my own mind up too. So I'm still lacking in this aspect, honestly. So I might have to talk to her and then connect with you later to see if such things are actually available somewhere and how we can adopt such technology into our production. Yes, so we might have to take this beyond this meeting.
It's okay. Thank you so much.
Yeah.
The good news is that they are available already, and that's the reason we brought that up. So not necessarily in Nigeria. And yes, Niyi and I can connect later so that we take it offline. Okay, thanks.
Thank you.
All right.
Dr. Daniel.
So
I saw you your hand.
So now I've not answered the second question, please.
Yes, you've not. No, you've not.
Yeah. Yes. I've had a lot of such cases, but the closest I've ever seen, which I confirmed by microscopy, was from broiler chicks that were 10 days old. when I was still 10 days old. When I was still a pathologist in Diversity Solutions, I confirmed these by microscopy. But the what actually solved the problem of that flock at that time was antibiotics. So that brought me to a question: if the cocci was just there at that time from vaccination, or they are just breeding, they are just multiplying, they have not yet started causing the pathology that will lead to mortality.
They were picked from the environment, from the field?
From a pen house or something. Maybe they are the one, but at that point in time, they were obviously not the primary cause of the mortality that the farmer had at that time. But I will confirm to you that I've seen day 10 before, which I confirmed by microscopy.
But we've not seen anything of earlier than day 10?
I've not. I've had things of day 10, but I will never agree unless I've confirmed it.
Okay.
Because a lot of other things can cause what it looks like cocci, which are not cocci.
Thank you so much. I'm grateful.
Thank you.
Okay. Dr. Daniel, please, are you still there to ask your question? Hello, Dr. Daniel, are you there? Okay. If any other person have a question, please. The floor is still open for questions.
I will encourage us to drop our contact. We are probably the contact of any other person that you know are interested. We want to create a community, or let me say a forum of our trainees, and we'll subsequently want the topics to come from you. We don't want to be the one issuing out the topic on our own. We want to address the real issues that are bothering farmers and other stakeholders.
Okay. Okay. Hello. Can anyone hear me?
Yes, loud and clear.
Yeah. I also want to run an occurrence from one of our farms this afternoon. We had a challenge with a particular farm. We run an Agora program. We run an Agora program in southwest Nigeria. So there was a particular farmer we had a lot of issues with. So we had to run antibiotic sensitivity test on the farm. And we discovered a good number of, most of the antibiotics we have around were resistant to that particular organism on that farm. And it was E. coli specifically. So that gave us an understanding of the type of antibiotics we should use in the next cycle or the production we started. And there was a particular antibiotics we chose because the resistance was quite low and the usage was quite also low in the farming, in the poultry community. And in this particular cycle, we've gotten less than 2% mortality in a 50,000 capacity production spread across Southwest, which is invariably still like an experimental production for us. But where I'm actually driving to is this. Do we have an updated antimicrobial resistant database in the country? Is there anything like that where people could actually quickly go to say, okay, what is the track record? What is the antimicrobial resistance data or history, generally from different sectors or from different parts of Nigeria or in Southwest, that can give farmer a predictive analysis to make right choices, or veterinarians? Because if we had not done that type of antibacterial resistance test or AST, probably we'll be having more challenges on this particular production now, especially for your brooding antibiotics. The first antibiotics you use, you need the first 5 days. So does Zoetis have anything like that?
Well, currently there is nothing of such in existence. And I will tell you that Zoetis alone cannot do, because this is a serious profiling. I mean, you cannot, a single organization cannot profile our antibiotics based on what they can treat and what is resistance to them. Again, this is not available, like I've mentioned, but again, it will be very difficult to have this kind of document because honestly, I could share fence with you as farmers, and then the same drug that is working on your farm will not work on mine, because these things are highly dependent on the management, the history of the flock. So for one thing I will advise you is each and every flock that you have run AST for, you have to look at the history of the flock. What have you used in the flock? What have you not used? What organism have you isolated? And then what you have used on that flock in the past, then you're able to say, okay, this is the antibiotics that I'm going to be using now. For instance, in some cases, the antibiotic that is most sensitive in a flock might not be chosen. It could be the second one, because you might have used that first one for a very long time on that flock, and you want to switch. And so you have to consider the history when you are interpreting antimicrobial tests. Then again, if you are running antimicrobial sensitivity tests for a particular flock, please don't use it as an indication for what you are going to treat with in the future, because bacteria are very, very dynamic in their population. So what you have today might not work in the next 72 hours. In fact, even within the same flock, if you run antibiotic sensitivity tests today and you ended up not treating, you might not be able to use it in the next week again, because things are changing. Bacterial population are highly dynamic. So it's a very, very tricky test. So it's not available now, and the test is the only thing we have. Then again, like I said, there are a lot of management programs that you can use now, like the vaccination, that can really, really reduce your dependency on drug. There's live E. coli vaccine, there's live salmonella vaccine, which you can even use for broilers. You don't need to inject them. You give them either from drinking water or by spray, and then you are able to reduce the negative impact of such organism on your flock, and also reduce antibiotic usage.
Okay, so sorry, I quite appreciate your input. I'm sincerely very grateful, but what will it cost us? For example, I'm also looking at a situation whereby before people can begin to say, oh, ciprofloxacin or quinolones, the resistance is quite low, or the resistance is quite high on the field, not even in the market, I mean on the field. There must have been some series of tests, series of baseline data that has been collected, which are being used to compare what is happening on the field. So I'm of the opinion that if probably even if it's not going to be one organization, or probably it's going to be funded by probably a bigger organization, international organization, I think it's something worthwhile we can give to the farmers as a reference point. Though it might not be completely 100% applicable, or let me use the word 100% fix, plug and fix, or plug and play stuff. But it will give the veterinarians an idea, it will give them some level of direction in the choice of antibiotics, which I guess will also reduce antibiotic resistance on the field.
I also agree with you on this. And like I mentioned, bacteria are very, very dynamic in the way they do their thing. So what I was trying to say is that this kind of document, we have to be updated frequently. So we might also need a kind of online database for these, so that it will be connected to the livestock laboratories. So these labs will be able to say, okay, within this region, so organism is resistant to this, and this. So we really need to work with the labs. It's like I said, it's not what a single company can do, or else it will just be like your own opinion. So we need to capture a bigger data, bigger information, to be able to say, okay, this is what is happening at this point in time. So what is happening now might not be what's happening next week. So things are, with bacteria, it changes just as much as their replication cycle is very short. So things can change for them within a very short period of time. So this is a welcome idea, but we'll need to create an online database, and it will be connected to a lot of, or if not all, our veterinary laboratories in the country. So that's the best place where we can generate such information.
Thank you, doctor. I'm grateful.
Thank you, sir.
Good afternoon.
Please, does any
everyone.
other person have question?
Yeah, somebody is asking a question.
Okay.
Good afternoon. Dr. Emmanuel is my name. At amazing presentation, I joined in much later. At what point do we consider the specificity? Talking of live vaccines, of course, there's what's on the field, and then there's what's been introduced in the vaccine. At what point can we say for sure or for certain that the vaccine strain of what live vaccines we're introducing is what is required or what is needed, in the region or in the farm, whichever? I've had to interact at one time or the other with people who tell me, no, I don't want to bring any vaccine, any live strains. But at what point can we be very sure and give a convincing argument that, okay, instead of bringing in antibiotics, vaccination, you are covered? This is, for me, a question. Thank you.
Thank you so much. This is a very wonderful question. Because of the fact that people did not really understand this concept, in most cases, they don't want to use the vaccine that's actually benefiting to them. I've seen people that told me that they don't want to use a killed vaccine. They don't want to introduce something to their flock. Now, the development of some of these vaccines has gone to a different level. Like the E. coli vaccine I just showed to you. If you give it to broiler, there was actually a research. If you give it to broilers at day 1 or 2, by day 35, you can barely detect it in the feces, in the intestine, and even in the litter. So the vaccine has come. It has stimulated protection, and then it's phasing out. So, because now, why I'm saying this is that E. coli is an agent of public health importance. So in Europe, in America, nobody wants to hear E. coli as much as possible. And so if I can send you some links to read more about this vaccine. They've actually turned the vaccine out, and just to look for fault. Is it going to persist in the flock? Is it going to persist in the floor? Is it going to be reverting back to virulence? And it's found to be safe. Actually, for this particular E. coli vaccine, the way it was designed was that there's a particular gene that has been deleted, the one that is coding for aromatic A. So it's ROA gene deleted E. coli vaccine. And then it can multiply in your flock for a limited period of time when it's still stimulating immune protection. And then after that, it dies off. So also for the salmonella too, they found a way to make sure that it comes in, stimulates immunity, and then it goes away. But within this period, they work as much as possible to keep the population of the pathogens, the real pathogens, at the barest minimum. So that's how they work. So but there are some, then again, it takes us to another level. We need to read more. If you look at the label of a lot of products, some product they will tell you, once you start using this product on your farm, you have to continue. So they will always indicate if that has been the case. Thank you.
I'll need the links. Thank you for the answer, Doctor.
All right, you can drop your contact and I'll send the link.
Hello, sir.
Hello, sir.
Hello, yeah. Sorry. Once again, I know, yes, you mentioned about E. coli and salmonella. What's your, what do you call it? Do you guys have anything for, fowl cholera, which is pastorella, which is equally a major problem in layers?
Well, this is a training. If very necessary, we make reference to products. to be, I mean, we have to be ethical. So maybe we should discuss that outside this meeting.
Oh, okay, sir.
Thank
Okay,
you.
Thank you.
Thank you. I will drop my number on the chat so that anybody can contact me. That's my number ending with 51. So I'll be able to answer or respond to any product related question after this meeting.
Yes, is there
So I
another
guess
question?
Yeah.
Does any other person have any question? Any other question? No? I think in the absence of none, I guess it's time to call it a day. Want to sincerely appreciate.
But as people are leaving, please let them drop their numbers. I've taken some screenshots in the past. Let me take more so that we can reach out to people after the meeting.
Yes, yes. Please, let's drop our number just like our facilitator has said. And then Dr. Bayo also have been reminding us on our chat. Should please drop your number so that we'll be able to create a platform that farmers can discuss, give advice on next seminar topics and all. So please don't let us forget to drop our numbers.
We want to actually address our need as farmers. We don't want to, treat topics that we think is best for you. I think the best for you is what is coming from those that are the recipients of our training. Thank you.
So if there is no other question, we'd like to call it a day. I want to sincerely appreciate our facilitator, Dr. Niyi Bankole. We are grateful for coming around. Thank you for the presentation. I want to also appreciate our participants for today. And then we hope that you have dropped your contacts so that the platform will be open for farmers to discuss their needs. So thank you so much. We are grateful on behalf of EVMEDS. We say thank you for coming, and we hope to see you in the next training. Thank you.
Thank you very much. So let's keep the meeting on so that we can take a screenshot. I can see somebody's number.